I would probably try to tonify a kidney and heart shunt. So we're just going to go through a few cases, and these are generalized cases that I see. A lot of these, I picked these animals because I see a lot of this thing with these animals, and these are the types of treatment protocols I use. So this is Daisy. She had severe arthritis in her elbows and hips. We did weekly treatments initially, and then we did points for her hip dysplasia and all along the gallbladder. Remember that circled the hip? The large intestine, remember that came down around the front of the arm, and the long intestine, which was in the inside of the arm around the wrist, pericardium, and then bladder meridians as well. Hunter had Wobbler syndrome, which is an instability in the cervical or neck vertebrae, okay? So we use the gallbladder 20 point a lot. That sinks right behind the ears of the animals. Bladder 10, which sits right on top of the second vertebrae. Governing vessel 14, which is lower in the midline of the back. Bladder 23, which is an association point for kidney, which is associated with any bony deformation, okay? And small intestine 3, which is on the outside of the knuckle, on the forepaw. It's a really good point for neck pain. Gibson, 9-year-old mixed breed, left forelimb lameness and neck pain. He didn't tolerate the dry needles, so we used the laser type treatment on him. So we would stimulate the acupuncture point with the laser on an individual basis. And we used triple heater, bladder, gallbladder, and stomach meridians for him. Pfinster's cat with chronic sinusitis. These cats are just maintenance issues if you ever had one. It's just trying to keep them comfortable and infection-free. You'll never cure them. So important points for him is yin tang. It's right in the center of the eyes here. Stomach 8, which is up here, is a headache point, good for head pain and pressure. Large intestine 11, there's that large intestine meridian again. It's on the front of the arm, goes on the outside. Large intestine 11 is a good point to stimulate the immune system. And then stomach 36. Stomach 36 is on the lower leg on the outside. It's notorious for just moving chi, getting things flowing. This was Bella. She had cervical problems. We ended up doing a lot of the bladder points here, gallbladder behind the ears. So every time there's a neck, I use that gallbladder 20, which is behind the ears. Some large intestine and small intestine meridians as well. Dudley, he had hip dysplasia and partial cruciate tears. So we use that stomach 36 because it is a tonifying point and moves chi, but it's also right next to the knee, okay? So it's a good point for knees. At gallbladder 34, goes alongside of the knee as well, but remember that also is an association point or special point for ligaments. So I want to strengthen his ligaments, right, because it's cruciate, it's partial tears. Bladder 23, there's that kidney association point again, helps with any kind of bony problem, arthritis, things like that. Bladder 40 is behind the leg. It aids in strengthening the back end.
How long does an individual treatment last in minutes? 10 minutes, 20 minutes?
It depends. If you want to tonify something or build it up, then I go no more than 15 minutes, okay? If I want something to settle down, then it's 20 to 30. With the exception of electroacupuncture for backs, that's a minimum of 20. That said, like I've had wobbler dogs that were young that I do electro on. They usually do great. That I like to keep the needles in for 20 minutes usually if I'm doing electro. Well, you have to look at every individual. I did an older dog that electro, first time you do an older dog anyway, you don't want to go more than 10 minutes, and did great. Next time I saw the dog, okay, I thought, okay, I'll do it, I'm gonna push it, go a little longer. Well, the dog got worse for, sometimes they're often worse after electroacupuncture for a day or two, because I think it just stimulates them to the point they get tired, but then you see them improve after a day or two. They're usually tired. Well, the older dog was just not well, or had trouble walking for three days, which is completely unacceptable. So what did I learn from that? I went way too long with that dog. It's 13-and-a-half-year-old Doberman. It was too much for it, so back up, back it down. One thing about acupuncture is, just like any medicine, it's not an exact science, but your feedback, the client's feedback with how the dog is doing is integral. It's really key. I'm going to look at the dog, look at it in a Western perspective, see what's lame, and say, okay, it looks like a partial cruciate tear, then think of it in Chinese theory, and I can pick my points and all, but still, I need feedback to know, how did the dog do this week? Now remember, initially, you might not see much for the first 3, 4, 5 treatments, but you will start to, and then we gotta, because I changed things up. They did better week 2 than this last time. Then I go to my notes, what did I change? Boop, it's out. Did worse, that new point, out. Did better a little, what I tweak. Okay, I'm staying that route. You know what I mean? It's all, working as a team together to get the animal healthy. Okay, important points everyone should know. Governing vessel 20 is right, if you look at the top of an animal and the ears where the midline, if you draw a line from the ear front to the midline, okay, so here's the front of the ears and you go right to the midline, that's governing vessel 20. Just petting that or massaging that area helps calm them down. That's often the first point I put a needle. Actually takes about 10 minutes to kick in, but it just calms them down a little, takes the edge off. Good place to massage if your dog gets anxious during nail trims. Governing vessel 26, again, this is the midline meridian down the back. The conception vessel was down the front, middle. It's right between the nostrils and the philtrum here. It's actually a resuscitation point. Sometimes we veterinarians will just tweak that or pinch it when the animal's under anesthesia and they're just not breathing regularly. Just pinch that or tweeze that. It can really help them just start breathing on their own again. During anesthesia, they can, you sometimes have to breathe for them a little bit, but if you just tweak that, sometimes it gets things going the way you want very easily.